I'm Debra Lawson. I'm the clinical midwife consultant for substance use in pregnancy and parenting service, and I'm located here in Newcastle, New South Wales. I've worked for Hunter New England Area Health Service since 1982, and I've worked with drug and alcohol clinical services for the last 5 years. I worked as a midwife and child health nurse for 26 years at John Hunter Hospital, and I worked with vulnerable families, mostly families that had drug and alcohol issues. And when drug and alcohol services got some extra funding to develop a new service, substance use in pregnancy and parenting, I applied for that position because I felt that it was a way to use my midwifery and child health skills in an area where there's a great need. It's great working with a multidisciplinary team because our clients are so complex and they have so many psychosocial issues that come along with their drug and alcohol issues as well. So it's wonderful to have the backup of some really skilled allied health clinicians and our medical officers as well. My day would look like, in the morning I will often contact clients either by phone or see them in person. Our service is lucky in that we're able to do home visits for some of our clients, and we can see our families throughout pregnancy and for up to 2 years after they've had a baby. So home visiting actually is a big part of our service, and it's great to actually be able to offer a service in the client's home where they're most comfortable, and you can really see what's happening for that family and how that family actually functions at home as well. So I would see clients. I also, as part of my role as clinical lead for the service, I do the intake, so all referrals that come through the service, I coordinate them as well, and I support other members of our team. Our particular service, we only service our 3 local government areas. We do service John Hunter Hospital, so we go up to the high-risk antenatal clinic and we provide some support there for our women and for the other staff there as well. But my role is I actually do provide support and education across the district as well. So I'll often get calls from rural practitioners saying, I've got this woman, I'm not quite sure whether to be concerned or not to be concerned, and what I can do for them. And I also offer a lot of in-service education to maternity and neonatal and child and family health services as well. There is so much to learn when you come to drug and alcohol, but don't be afraid, because we've got a great clinical nurse educator and some really great learning platforms. And so usually what happens when people join our team and have not been in drug and alcohol before is we give them time to actually do their learning so that they feel equipped to do the job that they need to do. We don't throw them straight in. We make sure that they feel like they can do that task, and we support them in whatever learning needs that they have. So we'll send them to courses, we'll get them to do some online training, and we work alongside them for a period of time until they feel confident that they can actually do that work themselves. I would say just apply. With nursing, the majority of the work that we do is learning on the job as it is, and it's a really wonderful, supportive environment here. I think the most important thing is to really have respect for clients and to really have that non-judgmental and empathetic way of working with clients, and all the other stuff we can learn as we go along. But it's really about understanding the stigma and the shame that our clients have and how we can work with them to actually improve their outcomes. I feel that every day that I work, it's just such a privilege to work with families and to be able to support them in their journey. Of course, we work on their goals, not our goals, and it's just lovely to see when families are given the opportunity to make decisions that improve their lives and to change, particularly when they've got small children or they're pregnant. Pregnancy is a great motivator for change. It's just lovely to be able to walk alongside them in that journey and actually see that they're actually reaching their goals and being the parents that they want to be. Come and join us. We're just such a great workforce, and particularly here in Newcastle, we've got such a beautiful setting. I've never worked with such supportive and inspiring colleagues. Everybody's really motivated to make great changes, and because our clients matter, our patients matter, and everybody has that focus, and It's just a great place to work.